How are you? I'm Dr. Gribble from the Vet on West Main, and today we're going to try to get you to understand heartworm disease a little better in your dog. My assistant Sierra is going to be asking a few questions that you might have as well, and I'll try to answer them and get you a better understanding of heartworms, treatment, symptoms, detection, prevention, whole 9 yards.
Okay, Dr. Gribble, what is heartworm disease and how can it affect my dog?
So heartworm disease is exactly what the title says, worms in your dog's heart. Those worms are spread by mosquitoes. Mosquito is part of the life cycle of the heartworm. So where there are large numbers of mosquitoes, there are large numbers of heartworms. Those worms live in the right side of the heart. They keep that heart valve from closing completely and basically put your heart into heart failure. So your dog can be experiencing symptoms of heart failure because of heartworms.
Okay. How would my dog catch heartworms?
Well, we just talked about that a little bit. Mosquitoes are the vector, which means they spread it. So they bite a dog that has heartworms, and those larvae will go through a life cycle in the mosquito, and then that mosquito can either put that back into the same dog or a different dog, and then that larvae will turn into an adult.
What are the signs in my dog that would indicate they may have heartworms?
So signs in your dog, good question, because sometimes it can be nothing. Sometimes heartworms is referred to as the silent killer because you don't even know they're there. Average heartworm infection is about 40 worms, so you can imagine 40 worms that are about 12 to 15 centimeters long living in a heart don't do too well with longevity. So some of the signs are no signs at all. And the worst case symptoms are symptoms of heart failure. So that is abdomen getting bigger, full of fluid, coughing, exercise intolerance, things like that.
Okay. What can be done to stabilize my dog's heartworm disease?
So, interesting phrasing of that question, what can be done to stabilize? So if you consider stabilizing not getting any more heartworms, prevention is the way to do it. And we recommend, of course, here in East Texas, year-round heartworm prevention. And the preventions that we use are very effective, and we recommend starting them 6 or 8 weeks old. So that's the one thing to, I guess from the question, stabilize the heartworm situation is preventing any new worms. If your dog already has some, that's a whole nother situation, trying to get rid of the worms that are already there, as opposed to preventing them from showing up in your dog's heart in the first place.
Okay. How soon should I bring my dog in to see the veterinarian for heartworm prevention?
So we start that as puppies. When we do puppy vaccines, we give heartworm prevention. When we boost those vaccines about a month later, we give another heartworm prevention. When they get old enough to get their last puppy shots at around 16 weeks old, we give a heartworm prevention injection that lasts for 6 months. And then when that runs out, we move up to an injection that prevents heartworms for a full year.
How will a veterinarian diagnose my dog as heartworm positive?
So there's a couple of tests. One is an antigen test, one is a microfilaria test. The antigen test basically tells us there are adult female worms in your dog right now. The other test, the microfilaria test, is a blood sample that you look at on a microscope, and you can see small baby heartworms swimming in the blood. So those two tests will give us a positive. And the other thing that you can do is an ultrasound of the heart. If you suspect heartworms and you get a negative test, there may be 1 or 2 worms which may not trigger a positive test, but you can see those worms with an ultrasound of the heart.
So now, Dr. Gribble, we're going to do a couple of frequently asked questions by the people.
All right, frequently asked questions.
Okay. How often should my dog be tested?
So we test every year at the vet on West Main and the vet on 4th and the vet on Broadway. We run a blood panel on all of our patients every year, which checks the kidneys and the liver and the blood glucose, and basically gives us an idea of what's going on inside the heart. That also includes a test for heartworms and for several tick-borne diseases. So yearly testing is what we recommend with all of our patients.
If my dog tests positive, do I need additional tests?
If your dog tests positive, so if you test positive on a antigen test, we can also run the microfilaria test to see if there are babies, because there are two different treatments, one to kill the babies and then you got to kill the adults. So we will need to test for adults and separately for circulating microfilaria.
And we get this question pretty often seeing clients. If my dog is on heartworm prevention, do they still need yearly heartworm tests?
So that's a good question. Technically, no. They don't need a heartworm test, especially if you're using the injection that we give that lasts for an entire year, because we know there are no lapses in coverage with that injection. However, it is a part of our blood panel, so we will get a test result every year, but as far as keeping him on the heartworm prevention, it's not necessary to test every year, but it's part of our panel.
Is heartworms painful?
Is heartworms painful? That's a good question. I'm going to say no. However, the symptoms it causes, which are fluid buildup on the abdomen, fluid in the chest, symptoms of heart failure, I would call them uncomfortable, because not being able to breathe well is not a comfortable situation. Is it painful? I guess that is, pain is in the eye of the beholder.
Are there risks associated with the treatment of the heartworm treatment or prevention?
Are there risks? Absolutely. When we kill those worms that have been living in the right side of your dog's heart, they immediately go as dead worms into the lungs. That's where the risk is. They can cause pulmonary embolism, which is bleeding in the lungs, and especially if there's an average infection of 40 worms, if 20 of those worms go at the same time into the lungs, that's going to be a problem. There is a very strict no exercise part of treatment right after we kill those worms. So it's very important to restrict activity, because if your dog goes out and chases a ball and the heart starts racing, it is more likely to push a group of worms into the lungs, which is a serious problem that could lead to death.
What are the side effects to the medication used to prevent heartworms?
Side effects to the medication. If there was one side effect that would probably be most common, however, very uncommon, would be an allergic reaction to the injection itself. Swollen lips, swollen eyes, similar to a vaccine reaction. It's treated like a vaccine reaction. It gets better like a vaccine reaction. It does not last the entire duration of that shot.
How effective is heartworm prevention?
Heartworm prevention, given on time every year, is 100% effective, unless you deal with a resistant worm, which is a possibility. The closer you get to the Mississippi River over in Louisiana, Mississippi, there are resistant worms emerging to older heartworm preventions that have been around 20 or 30 years. They just lose effectiveness. The newer ones, like moxidectin, which is what we use, and the injection that lasts for a year, has been proven effective even against resistant worm strains.
Right. What should I do if I miss a dose of my dog's heartworm prevention?
If you miss a dose of prevention, start them right back on it as soon as you realize, hey, I missed a dose. That could lead to a window of infection that won't show up for about 6 months. So if you come in and we run our yearly testing and we get a positive, then we're gonna say, okay, sometime between 6 and 12 months ago, there was, excuse me, a dose missed, or we're dealing with a resistant worm.
What are the different stages of heartworm diseases?
Different stages. Well, that has to do with the life cycle. So without getting too much into the biology of the life cycle, you have immature worms, which are created by adult worms in the body. They are called microfilaria. Microfilaria get extracted by a mosquito. They go through another part of their life cycle in the mosquito. Then that infected larvae is back into the dog, and that larvae can turn into an adult. So basically you have adults, microfilaria, and infected larvae.
Can my dog die from heartworm disease?
Can your dog die from heartworm disease? Absolutely. We see dogs dying every month from heartworm disease. In Northeast Texas, considered an endemic area. It doesn't get any worse than right here. Maybe down on the Gulf Coast, it gets even more severe. But if you don't prevent heartworms in this area, your dog will get heartworms in this area.
Can my indoor dog get heartworms?
So I don't know of that many dogs that stay indoors 100% of the time. Although you may be considered an indoor only dog, I can almost bet that that dog goes outside to do his business. Some dogs stay with their own puppy pads. Okay, that's a very small number of dogs. And mosquitoes can get inside your house. So heartworms can get inside your house. So we've covered a lot of material here on heartworms. If you have any questions about this topic, give us a call. We're here to make you have more good years together with your pet. Thank you.